appreciate that. I want to welcome everybody and thank you so much for coming this morning to hear what we have to say about fentanyl in the county of Fresno. There are several distinguished people here with me today from many different agencies, and we are going to have 9 speakers today. The purpose of our press conference today is to discuss the ongoing attempt from agencies, from the health department to education to law enforcement, to make people aware of the dangers and the commonality that fentanyl has in our society today. We are not going to be commenting on any ongoing investigations, any recent cases, any past cases. So please don't make me and Lisa come out by asking those questions because they will not be answered. I would like to be pleasant to Lisa today. I am going to start out, and then we will have Kim Sanchez from the United States Attorney's Office speak. We have Jeffrey Barbero, who's a supervisory special agent with the Department of Homeland Security Investigations. We have Chief from Fresno Police Department, Paco Balderrama. Did I just say Balderrama? Let me try that again. We have our new Fresno Police Chief, Paco Balderrama. Paco, you're making me so nervous. I'm sorry to misstate your name so many times. I even know how to spell it. It's 2 R's and 1 M. And we also have Benny Ortiz here with us. He is a assistant special agent in charge at the DEA. We have Assistant Sheriff John Zanoni from the Fresno Sheriff's Department. We have Jim Yovino, our Superintendent of Fresno County Schools. We also have Dawan Utecht, the Director of Fresno County Department of Behavioral Health, and Dr. Rais Vohra, who we are all familiar with through the COVID pandemic, who is our Fresno County Health Director. So I am going to start out and let you know that the Fresno County DA's office is proud to stand here because behind me today is a group of community heroes who have spent months and in some cases years attempting to educate the people of Fresno County and the surrounding areas about the lethal dangers of fentanyl. And quite honestly, not enough people are listening. So it's time for kids, adolescents, young adults, parents, teachers, grandparents, educators, law enforcement, people of all walks, people of all colors, people of all races and religions and socioeconomic backgrounds to stop being ignorant. Stop saying it's not going to happen to me. It's not going to happen to my family. It's not going to happen to my kids. Because I will tell you every single day, I have 2 teenagers at home and I lecture them ad nauseum over and over and over again because my children are not above it and neither are yours. It is time to say enough is enough for the senseless addiction and killing of our young people and the overdoses and the damage that's happening to these young children's lives because of fentanyl. Fentanyl is an opioid narcotic that is used to treat severe pain. It has a very high risk of addiction and dependence and can cause immediate respiratory distress and death when taken in small doses or when combined with other substances such as alcohol. It is 50 to 100 times more potent than morphine. Street fentanyl is something that is even more dangerous. It is a synthetic, man-made substance that's become commonplace in our communities. It has a heroin-like effect and causes a high that causes children and young adolescents and users to constantly chase it. It's being manufactured in China, imported to South America and Mexico, and it's being added to pills that are pressed by drug cartels and sold on the streets of cities all over the United States and right here in Fresno County. Dealers of these drugs are oftentimes young people who distribute them to their peers, their friends, and they use social media and cash apps on their cell phones to deliver to most users who never have to leave their homes, their schools, their social circles, or their normal daily lives to access these deadly pills. The users of these pills become addicted in many ways. Oftentimes, it starts in the home. They may have a sports injury, a surgery, simple recreational use, experimentation, or it can progress in drug use. When they start to use any type of opioids and their supply runs out, they oftentimes turn to street drugs. And now these drugs that they buy from drug dealers are being laced with fentanyl. And many people ask, why would drug dealers want to lace pills with fentanyl knowing it can cause death? And the truth is that it creates such an incredible high that the user can quickly become addicted, and they will continue to seek that drug out. Drug dealers don't care who dies. Drug dealers care about selling pills and making money. So sadly, in the state of California, our legislature and our assembly people and our senators have decided that the decriminalization of drugs is the nouveau riche thing to do. Drug sales and drug trafficking are to the point where there is little to no accountability, and thus local and state officials have to collaborate with our federal partners to attempt to secure meaningful prosecutions. That's why many of these people standing behind me are actually federal government employees. They work at federal agencies. There is no way to investigate or prosecute our way out of this crisis. This is why education and awareness is the most important part of fighting this war. And I'm going to say that again. Education and awareness is the most important part of fighting this war. We cannot investigate our way out of this. I'm going to say it again and again and again. The key is a coordinated effort to educate our communities so that we can prevent our children and young adults and addicts from ever using in the first place. Once people are addicted, getting clean is very difficult and it is a long process. We talk a lot about overdose deaths, but what doesn't get mentioned frequently enough is the amount of overdoses that don't result in death. And what they result in is damage to the brain, the heart, and the respiratory system. Members of this team behind me have seen teenagers and young adults right here in Fresno County who have overdosed, been treated, been saved, and then go right out and use again and overdose again within a 24-hour period. That shows how addictive this drug is to the human body. I am now going to turn the podium over to the rest of our speakers. Please listen intently as they each have important information to share. Share this live feed with your family and your friends and help us stop this senseless amount of addiction, pain, and fatal drug from infecting our community. At this time, I would like to introduce my esteemed colleague at the United States Attorney. She is Chief Assistant United States Attorney Kim Sanchez.
Thank you, Lisa. I've been a prosecutor for 25 years, and this particular problem is one of the most troubling problems in the drug trafficking community and our youth community that I've seen. I am fortunate enough to be working with a number of folks in this room from all different disciplines. We came together a couple of years ago, recognizing independently that there was a growing problem, a very fast-growing problem among our children. This wasn't just affecting adults and people who are long-term drug users. This problem with fentanyl started to affect our children in schools, some as young as middle school, often in high school, from all walks of life. And many of those who had no experience with drug use, many of those who had no idea what they were taking and what they were putting into their system. But people in the education system, in the behavioral health, in the health system, mental health, law enforcement, all saw a growing trend of young folks taking these clandestinely produced and bought drugs and dying. And like Lisa said, some not dying, some overdosing and causing irreparable damage to their bodies that were going to affect them for the rest of their lives in conjunction with their addictions. So a group of us came together, and our sole goal is really to educate the community, and we agreed on this at the beginning. It wasn't to prosecute people, it wasn't to investigate people. That wasn't our prime goal. Our prime goal was to stop users from using and to let the young people and their families know that what you think you're taking may not be exactly what you think you're taking, and you have no idea what is going to happen after that. and you could die from it. Part of that, from the federal side, is that there is a tool we have. If we can't just announce to the world, stop doing this, and they're going to stop doing it, we're also going to go after the sources of the drugs and try to stem the flow so the availability isn't as prevalent as it is right now. And so the message, I think, here today is threefold. One, to the families, take care of your kids, talk to them, tell them about this drug, tell them what they're facing if they take pills that they think that are just from somebody's medicine cabinet. They probably aren't. To the kids, don't put this poison into your system. We've all been young and we all make mistakes when we're young. Don't make this one. This is bigger than you think it is. And to the people who are dealing these drugs, some of whom are very young, 18, 19, they should be headed off to college. There are lengthy prison sentences that nobody wants you to face, but you're going to face if you continue to deal and we catch you doing this kind of drug dealing. Thank you.
Thank you so much, Kim. Next, we have Supervisory Special Agent with Homeland Security Investigations, Jeffrey Barbero.
Thank you, Lisa. Good morning, everyone. What I'd like to take some time this morning to talk about is what law enforcement in the county of Fresno has done thus far to answer the call against this epidemic and this threat that we are all facing each and every day here. Homeland Security Investigations, in conjunction with the Drug Enforcement Administration, DEA, and the Fresno Police Department, backed by the gentleman you see here today, we have started and formulated a very targeted and specific task force, referred to as the Fentanyl Overdose Resolution Team. FORT's mission here against this threat is to respond to the scene of an overdose, with or without a fatality, to investigate the facts and circumstances around the event. Ultimately, searching, hunting down the sources of supply responsible for these events. I want to stress what I just said and the point about sources of supply. Our main message for the communities is to know that we look at each and every event as a victim. We are not interested in investigating and prosecuting victims of these events. We have an immense amount of depth and breadth to our federal agencies independently, state and local law enforcement here, and the united effort in nearly 20 years as a law enforcement official. I have never seen cooperation that the County of Fresno has and the law enforcement organizations here. United, we stand a chance. We will take our authorities on a global pursuit against this threat. We are urging the communities to assist us. The federal government loves fancy terms, whole of government approach. Today, I challenge you to be a part of a whole of community approach. Work with us, talk to us, give us the opportunity to hunt down the people responsible. This is a local issue with global implications. Thank you all for your time.
Thank you so much, Jeff. At this time, I'd like to invite Fresno Police Chief Paco Balderrama to the podium.
Good morning, everyone. Thank you for being here and covering this event, and I want to thank our law enforcement partners, but especially Lisa Smitkamp, our district attorney, for bringing us together here for this very important cause. You know, I'm here not just as the Fresno police chief, but I'm also here as a parent myself and as a person who cares about the youth of this community. And bringing awareness to this issue is very, very important, because in the last few years we have seen a significant increase in these types of pills in our community. So we need to be aware of it. We need to be aware of the overdoses. We need to be aware of what we're doing to keep these types of drugs away from our kids. Every Fresno Police Department officer carries Narcan in their vehicle, and we do this out of necessity. We do this out of necessity because at times we are called and we're the first responders at the scene of a drug overdose. And we have documented cases of saving people's lives, mainly children, youth, young people who have overdosed because they have no clue what they're taking, and it affects them adversely. We also carry Narcan because it can save a police officer's life. We have documented cases across the country where officers have become very ill and almost died because they've been exposed to fentanyl. All you have to do is touch it, and it will enter your system, and it can hurt you. We've even had situations where canines have been exposed to this, and luckily this medicine works on them as well. So we do this out of necessity. We will continue carrying this Narcan in our police vehicles, and we will continue training our police officers on how to recognize victims who are overdosing of this drug. This is an attempt to bring awareness. This is an attempt to talk about consequences. There are consequences for using these types of drugs, and people will be held accountable. But the main thing is to persuade our parents to learn, become aware. Look at your kids' phones. Look at who they're hanging out with, where they're going, what they're doing, because this is something that is flying under the radar for far too long, and we have to do something about it. Law enforcement is here, partnering up with our prosecutors, both at the state and federal level, to send a strong message that we can't remain silent anymore, and we have to do something about it. Thank you.
Thank you so much, Chief Balderrama. Next, I would like to invite Benny Ortiz, who is the DEA Assistant Special Agent in charge. Benny? Thank you.
Good morning, everyone. My name is Benny Ortiz, and I'm the Assistant Special Agent in charge of the Fresno District Office of the Drug Enforcement Administration. I would like to thank District Attorney Smith Camp for putting together this press event to bring attention to this urgent public health issue. I'm standing here in front of a group of professionals representing not only law enforcement, but other state and local agencies that do care for the community. We are parents, grandparents, aunts, uncles, brothers, sisters, and especially members of this community. DEA is fully committed to protecting those we serve, and it's a privilege for us to do that. We are working together for a common cause. We are members of the Fort, and we are dedicating all the resources, intelligence, manpower, everything that it takes to get a message, and everything that it takes to catch those responsible that bring that poison to our communities. It doesn't matter if it's across the street, across the nation, or in a foreign country, or those who hide behind a computer screen. We will go after them. My message to the kids is simple. Do not experiment with these substances. This is a very, very dangerous substance that could kill you. My message to the parents is communications. You gotta talk to the kids, know where they are, okay? There's a lot of resources out there, not only in our website, dea.gov, but it's also a lot of websites that are specifically designed for parents, educators, and caregivers. This is an endeavor that is not to be taken alone. Help is here. So if you see something, say something and save a life. Thank you very much.
Thank you so much. Next, we have Assistant Sheriff from the Fresno County Sheriff's Department, John Zanoni.
Thank you, Lisa. First of all, I'd like to thank all the law enforcement partners, state, local, and federal, that are standing here behind me, who are putting forth a strong effort to help reduce these types of events in our community and to stop the flow of drugs like fentanyl and other dangerous drugs that get into our community and get in the hands of our children. As the chief said, as the DA said, I'm not here today just as a member of law enforcement. I'm also here as a parent who raises kids in this community. I have a 12-year-old and a 15-year-old, and this recent incident gave me a great opportunity to sit down and have a conversation with them about what they know, what they don't know, things they see, things they hear, to educate them, to make them aware of what's going on, and hopefully by hearing it from a parent, kind of as an ounce of prevention. As many of my colleagues behind me have said, we're not going to investigate, we're not going to arrest our way out of this. There's one way out of this. It's education, awareness, and prevention. And it doesn't just apply to drugs and fentanyl, it applies to child sex trafficking. It applies to presentations I give regarding internet crimes against children. It applies to presentations I give or people I talk to regarding how do I know if my kid's in a gang? How do I know? Parents have to pay attention. You have to communicate. You have to get involved. You have to look at your kid's phone. You have to see who they're hanging out with, where they're hanging out, and you need to pay attention to all those things. And then obviously, as I just said, communicate with your children, because communication is key to find out what is going on in their lives. If you don't talk to them when they're teenagers, I think we all know they won't talk to us. So just wanted to hit that real quick. Before I get into these numbers, I want everyone to remember that these numbers I'm about to give you aren't just a number. They're someone's daughter, someone's son, someone's dad, someone's uncle, someone's grandparent. They are a person. And it is very sad when you think about the number of people in our community that die as a result of drug overdoses. I'll give you some quick numbers. In 2018, there was 123 drug overdoses that resulted in death. 68 were as a result of methamphetamine. 2 were as a result of fentanyl. In 2019, that number increased to 164 drug overdoses here in Fresno County, recorded by the Fresno County Coroner's Office. 91 were related to methamphetamine overdoses. 15 were fentanyl. Jumping ahead to 2020, we had 254 drug-related overdose deaths. 148 were related to methamphetamine and 35 to fentanyl. So as you can see, we're starting to see an uptick in not only the number, but the number of fentanyl and the number of methamphetamine-related deaths. In fact, in 2020, we had 193 deaths that were related to motor vehicle accidents. Compare that to the 254 for drug overdoses. Currently, this year, we've had 16 confirmed fentanyl drug overdoses as of May 31st, 2021. There's still anywhere from 10 to 15 cases that are pending toxicology results. If we keep on that trend, we will either meet or outpace the 35 fentanyl-related deaths that we had last year. We talked about deaths in the opening. DA Smitkamp also talked about those that don't die. And that's also a very, very good point. These are the folks that died. What about the folks who have suffered irreversible medical conditions, from brain damage to paralysis to heart conditions to a variety of things that I'm sure some of our medical staff will be able to get into here. People that are harmed from here moving forward, and their lives will be forever changed, not because they died, but because of the effects that the overdose has on them. Some other numbers. Our yearly average, typically 25 to 30% of our drug overdose deaths are female. The other 70 to 75% are male. We try to figure out what causes people to use drugs in this manner, what causes this. Obviously, there's an availability of drugs. The decriminalization of drugs, making drugs from being a felony to a misdemeanor. The social acceptability. COVID-19 for the last year, keeping people locked up, keeping people isolated. Well, guess what? They were isolated, but I'm sure those drug dealers and those people who supply them drugs were still able to make those deliveries while our kids and other members of our community were sitting in their homes trying to be socially distant because trying to protect themselves from COVID-19. That's all I have. Thank you.
Thank you so much, John. There are a lot of people in this community who are very passionate about educating and protecting children, but I don't know anybody that has the passion of this man. So I would like to now introduce Superintendent of Fresno County Schools, Jim Yovino.
Good morning, everyone, and thank you, DA Smitkamp, for putting this together today. Someone asked me yesterday about my talking notes, so I brought them, and these are my notes. It's just that simple, and I'm, we're all we're all struggling in our community to reach our kids. And I want to start with my help ask to the media. You're all here today. I know you all. I can look at you. I can talk about your families with you. Look, this is a family crisis in our community. I need the media to do us a favor today. And that's that, we don't want to turn this into a drug-free, don't do drugs this week, and then we don't talk about it the rest of the year. I know you're going to put this together tonight, and it's going to be a great package. It's going to air. But I need you to air it every day. I know I'm asking a lot. I need you to be on your social media pages. I need people to see it. You can spread this message far and wide. And I know you'll do that because I know how much you love this community just like I do. So that's my first ask to all of you. My other help ask is to our families in our community. And that's, as you've heard over and over again up here, there's help out there for you. Lots of help. Ask for it. In fact, a young lady who I know really well sent me something that talked about the hardest thing that she's ever had to do. In fact, she said it was the bravest thing she's ever had to say, and that was to ask for help. Parents, you have to ask for help. It's out there. There's so much help out there right now. I'm looking at my friend Dawan Utecht and all that we do in Fresno County around behavioral health, mental health awareness, which we need to destigmatize this idea of mental health that we can't talk about it. It doesn't make any sense. We need to talk about it. It's okay. Kids who are making choices, who are self-medicating, there's a reason for it. These kids aren't criminals. They need help. We need to help them. So I need you to do that as parents. Talk to your children. And the last help ask I have is simply to every student who may be watching this. And I know this probably isn't the media that you're going to be watching, but I guarantee you over the next 12 months, you're going to get tired of seeing it because we're going to bombard every social media outlet in this county to get to children so that you're hearing this message over and over again. But I want to say to the students, help me. I mean, just help us. I can't do this. I mean, I'm good at a lot of things, but I'm not good at how to get to you on TikTok or other social media platforms. When this information comes out, I need you to help me share it with every child in this county so that they can think twice about what you heard prior to me speaking. It's the only way it's going to stop. Then I also want students to know that we're in partnership with the Fresno County Department of Behavioral Health with putting a mental health clinician in every single school in Fresno County. There's no one doing that in the state of California, no one. But it's happening in Fresno. And it's been a 5-year build out. I think we're in year 4, Dawan. I think we're in almost 200 plus schools already in our county, and we'll have one at every site. They're there to help you. So reach out to them. But there's one other problem. You may not even know it exists. And that's our problem. That's on me. I've got to do a better job of reaching out to you, to students, so that you know of programs like this called All for Youth. And it is all for any youth. It doesn't matter who you are. It's not about insurance or non-insurance. Any child that needs any help at any time around mental health, social emotional support, we're going to be there for you. We also have another program, parents, is called Help Me Grow. It's a 24-hour line. It's not a hotline, it's a helpline. It's there to help you. That's also in partnership with our county. And I know I don't want to steal Dawan's thunder, but how can you not remember this number? 600 WARM, right? WARM. For those of us who are older, we dialed with letters. It's call that number. It's for you. It's there to support you and help you. So I just end with this. Look, I try to sum up my job in the community as the county superintendent of schools, and it's really simple. You know, I'm supposed to help kids achieve their academic success to go on to careers. But really, it's much more than that. In fact, if I were to say what is it that I'm supposed to do, I'm supposed to protect you. That's my job. There are 71 county superintendents in this county, 71, not just the 32. There's charter schools, public schools, there's faith-based private schools. We've been working with Dr. Vohra the last 15 months and Dave Lucchini about COVID. We meet every week, and we've been able to put things in place so we can get our kids back in school. You know, if we can do that, I know we can fix this. But we got to do it all together. So again, I'm going to stop where I started. Media, I need your help. Okay, I need to see them on your social media pages. I mean, I know you. I know your heart. I've talked to you about things. I need your help. It's the only way we're going to make a difference. So with that, I'll just say, you know, thank you for being here today. And again, get this information to out, All for Youth, Help Me Grow. They're two great resources. So please take advantage of this. Thank you.
Jim, thank you so much. You are an amazing advocate for children. The next speaker is Dawan Utecht, who is the director of Fresno County Behavioral Health. And every single day that I get to talk with Dawan, I get smarter. Every single day that I learn from her, I feel more involved. And she motivates me to keep going and to keep fighting for kids and fighting for people. So I want to introduce my friend and somebody that I'm so lucky to work with every day is Dawan Utecht.
Good morning. It's really exciting to have such a solid group of people literally standing behind me as we do this very, very challenging work. As the director of the Department of Behavioral Health for Fresno County, I too am gravely concerned about the incidence of substance use in our county and particularly deaths associated with use. As you heard earlier, we have seen a consistent rise in overdose deaths in the last several years. This wasn't mentioned, but our average age of death is 47. However, we have seen an uptick in younger overdose deaths, including under 18 years old. Substance use often starts in youth. We know in Fresno County, we've done the studies that youth who use drugs typically start between the ages of 12 and 14. They typically begin with alcohol and marijuana. Next, we see use of prescription medication and other illicit substances, often culminating in adult methamphetamine use, which is our most widely used drug in Fresno County and in the Valley. As adults, as you've heard from all of my colleagues up here, we have a responsibility to do everything that we can to make sure that our youth grow up to have healthy lives and bright futures. And one thing that stands in the way of that is drug and alcohol use. We know that substance use can affect adolescents' long-term physical and mental health, as well as school performance, criminal justice involvement, and future job prospects. Together, we can prevent this from happening. It's our job to support policies and programs that prevent and reduce drug use in adolescents. Most of that use does begin in their teens and early adulthood during a time when they simply haven't developed the tools on their own and resilience to manage it. If we can impact these early years, we have our very best chance to stave off lifelong addiction. We all have an obligation to keep our kids safe and healthy. Somehow in our society, we've normalized adolescent drug use. We describe it as a rite of passage or normal phase that kids go through. As adults, we often model substance use as a coping mechanism. However, imagine that adolescence is represented as a pot of water sitting on your stove. Many experiences in adolescence can cause the water to heat up, maybe even simmer. Stresses at home and school, navigating young friendships and relationships, understanding our sexual and gender identities, preparing for college and adulthood, enduring a pandemic. When you put substance use in the mix, the pot boils over. As adults, our job is to help kids learn how to regulate that temperature, how to recognize when the water is getting too hot, to help make sure that it doesn't boil over. Unfortunately, fentanyl takes ice cold water and boils it over immediately. We need to find ways as a community to turn down the heat for our kids, to create environments where it's easier for kids to avoid substance use, for us to be able to talk about the issue, which can have huge positive carryover effects on their health, school performance, criminal justice involvement, and future job prospects. So it's important for kids, parents, and adults to recognize when substance use is happening in a youth. But it can't just be about that youth and that parent. We also have to acknowledge that it's already happening in all of our neighborhoods, all of our schools, and all of our communities. We want the youth, their families, and all of our community to know that help is available, both to help someone who's struggling with substance use, as well as medication to treat opioid use, including overdose recovery medications such as Narcan. If we're going to turn this tide, we need to normalize the conversation that substance use isn't a rite of passage and has inherent, even deadly risks. Our department is working with our partners to message youth, parents, and other trusted adults to know the signs and symptoms and how to access services. Over the next few weeks, we'll be creating packages of messages that can be sent out on social media platforms like Twitch and TikTok, and the type of social media that as parents we don't use, but they use. And we'll make that available to any entity in our county who would like to put their logo on that package and push it out in all of their networking. If you or a loved one need help, please call 1-800-654-3937. That is our 24/7 access line. We also have two websites, www.recoverfresno.com and www.havethetalkfresno.com, that gives resources to parents and adults about how to start that conversation with youth so that we can begin to normalize the right things in our community. Dr. Vohra is going to be talking to you about Narcan and how we use it to combat overdose, but I really want to emphasize that's the last measure. That's the thing you do when you've gotten to the point that they've taken that drug. It's our responsibility as adults to not allow that to happen and to keep our kids safe.
Thank you so much, Dawan, for all your work. Somebody who has become a local celebrity now, somebody who has helped us carry ourselves, our communities, our families through this terrible pandemic, along with Dave Palmaville. I'd like to introduce Dr. Rais Vohra at this time. Dr. Vohra.
Thank you and good morning. At the risk of sounding hyperbolic, let me say it this way. The biggest threat to health in Fresno County is no longer COVID. It's substance use. It's been around for a while. It's getting much worse. And recent events have shown just how pervasive this is in every community. We may have people that are members of our community that believe that it's not affecting their neighborhood because they're not in the big city, or they're not in the small town, or they're not in this part of the county or that part of the county. None of that really holds true. This is affecting almost every neighborhood in Fresno County, as it is all across the nation. In the US, it's estimated that during the pandemic, 90,000 people lost their lives to opioid use disorder, to opioid overdose. Here in Fresno County, we lost more people to overdoses last year than we did to car crashes. As my colleagues behind me have said, we all need to come together and we all need to activate a community response in the same way that we activated such a strong community response to help fight COVID. This is the new pandemic. This is how we need to address it. As an emergency physician, I see the consequences of substance use disorder and opioid overdose every time I work in the emergency department. And to some extent, those are the fortunate people that actually had 911 or a relative carry them into the emergency department. However, they still suffer a lot of consequences, including irreversible brain damage in some cases, and prolonged ICU stays and hospitalizations, all of which are extremely stressful, extremely costly, and definitely not normal for a teenager or a young adult to go through at the prime of their life. This is happening right now, today, in Fresno County. We all need to come together, help cover up each other's blind spots, and teach each other what's going to work moving forward. I wish I had all the answers. I wish that there was one agency that could just snap their fingers and take care of this problem. But unfortunately, this is one of those wicked, complex problems that's going to require all of us together, teaching each other, learning from each other, sharing information, and moving forward a little step at a time, but making forward progress as best as we can with the best knowledge that we have. What I'd like to talk today about is a couple of different resources. As grim as this picture is and as bleak as this picture is, there's actually hope for people that are struggling with addiction. One of those is a medication called naloxone or Narcan, and I'll demonstrate how to use Narcan. I feel like it does provide hope for people because it allows them to be resuscitated in case they ever have an overdose. Like Dawan said, we don't ever want anyone to be in that situation, and we need to get them help long before they are put in that situation. But reality is what it is, and we know that there are people that are going to be trapped by addiction and eventually overdose, and having Narcan accessible to them, I think of it as like an EpiPen. Minutes and seconds count, and you have to administer it right away, and that's why we need the whole community to understand what Narcan is and to use it as soon as it's needed. The other piece of the recovery that I think we really need to emphasize, and I'm going to challenge our media partners to really talk about this more, is that there are many, many recovery resources available. Starting in the emergency department, the minute somebody comes into the emergency department at Community Regional Medical Center, and there's many other hospitals that are doing this now, they're going to get screened for substance use, and they're going to get offered immediate recovery resources in the form of medications that will help them take away their cravings and help them feel better if they're in opioid withdrawal, and access to counseling and other resources through the Department of Behavioral Health. All of that is available. So I think that there is this myth out there that there's not enough resources for people, and once you get addicted to a drug, that's it. That's absolutely not true. There's actually a lot of help available. If you take one step, I think we've got a system in place that will take many steps towards helping those of us that are struggling with opioid use disorder and substance use disorder. So please keep that in mind, that as grim as the picture is, we all have a part to play, and knowing that we can empower ourselves will hopefully help us overcome a lot of the denial and a lot of the paralysis that is leading this problem to become even worse and worse day after day and month after month. So with that, let me do a quick demonstration of the naloxone. You've probably all heard of Narcan, but many people don't even know exactly how to use it. And it's actually pretty simple to use in the kits that we have available. These kits are available free of charge at Community Regional Medical Center, at Clovis Community Medical Center. We want every emergency department in the county of Fresno to be able to offer these. So we are working with the state to help get free Narcan to get handed out to our patients that are at risk, and to families that are worried that while their loved one is struggling with addiction, that they may have a fatal overdose. So you'll be hearing a lot more about our Narcan programs moving forward. As the police chief said, our police partners and our law enforcement partners have already been trained, and they are also first responders when it comes to opioid overdoses, and they can also administer this medication. I have here a box of naloxone. This is 4 milligrams, and it has 2 doses, so a total of 8 milligrams inside this box. When you open it up, it's really well done, we have lots of boxes, so if you need to get close-ups, et cetera, then we'll definitely be able to help you with that. But it basically walks the person through exactly what to do, and it's very easy. First, call 911. Second, while you're waiting for 911, you'll see that the medication is in this dispenser that looks like this, and it has a big nasal prong in order to be able to distribute it right inside the nasal cavity. Whenever a person is passed out and overdosed, you basically just lift up their nose and put one of the prongs inside their nostrils and squeeze. and you've delivered the medication. Wait 2 minutes. If they're not waking up immediately, deliver the other unit inside this box. So they should get a total of 8 milligrams, and hopefully that will buy them enough time so that EMS can arrive and do what they need to do in order to help continue the resuscitation. I want to stress this should never be the last chapter of someone who is struggling with addiction. This is simply something to get somebody back awake so that they can continue to live, so that we can provide them with the other resources of recovery that they need to say, hey, whenever they get better, let's get you into some counseling. Let's get you into a clinic that can help you with your addiction. This really needs to be used as part of a whole set of interventions that we need the whole community to help us with. But this is an important part, because if this is not used, the person can go on to die. They can go on to have irreversible brain damage. And if we don't give Narcan to a person who's overdosed, then we'll never get them back, and recovery won't even be an issue for that individual anymore. And obviously, that's a tragedy that we want to prevent as much as we can. So that's just a very brief walk through Narcan. There's lots of videos available that we can share, and we'll be making our own videos through Fresno County in order to educate all of our communities on how to use this in multiple different languages. But we really need everyone to understand what Narcan is and how easy it is to administer to someone who's overdosed. You might have some questions about what an opioid overdose looks like. Well, in general, opioids do take away pain when they're used for medical purposes, but whenever somebody overdoses on it, they not only take away pain, they take away the ability to breathe. So the most important sign of an opioid overdose is you're not going to be able to breathe, or you're going to struggle to deliver oxygen to your tissues. Whenever someone doesn't have oxygen to their tissues, they usually look blue or even gray. And so that's another big sign that someone is suffering from an opioid overdose. Not breathing really well, snoring or making difficult sounds because their throat is closing up, and they're blue and dusky. That's really all you need to know. There's other signs and symptoms that doctors look at, and other labs and things that we can do later on down the line, but that's not where the community needs to be. The community just needs to understand if someone's down and not breathing, you really have to think about opioid overdose, especially if it's a young person that's otherwise healthy, and you really need to understand how to have Narcan and how to use Narcan. A generation ago, we had a problem with people having heart attacks and just dropping dead in the street. And as a community, America came together and said, we're going to teach our community CPR. Well, I challenge you today that the new CPR involves Narcan, because so many young people are losing their lives and losing their livelihoods because of the opioid epidemic. This is the new CPR, is making sure that all of us know about Narcan and know how to use it. I'll end my remarks there. Thank you very much.
Thank you so much, Dr. Vohra. That's amazing. This is actually the first time I've ever seen Narcan used. And so I want to thank you for educating me and the rest of the community today. There's two people in this room who are not behind me, but have been behind my personal involvement with this issue, and that is one person from the Fresno Police Department who is a task force officer with the DEA, and one person who works for Homeland Security Investigations. And so I want to thank them personally. Dre and Dino, you know who you are. Thank you for sharing with me and for your passion. The Fort team is amazing in this community. We are so fortunate to have it here. Parents, teachers, educators, you are our first opportunity. You see your kids, you know your kids. Pay attention. Life is busy. We're all busy. We all have too much to do. We all put too much on our plates. Pay attention to your kids, because if you don't, you could lose them. People who are using opioid-type pills, whether they're laced with fentanyl or not, are not easily detected. Alcohol you can smell, marijuana, cocaine, methamphetamine, they all have objective signs of intoxication. This is a silent one. You may have a child that is taking opioids that are laced with fentanyl that become happy, and they may take it once or twice or 5 times without an overdose reaction. And then the next time, the one pill, the one delivery, the one Snapchat exchange can take your child's life. So it's time to get your head out of the sand, to stop thinking it can't happen to you. because every parent that every one of us has dealt with up here never thought it was going to be their child. Looking back, hindsight is sometimes 20/20, and sometimes there's not many signs. So again, we cannot stress the importance of education and awareness to lead to prevention, which is our best tool in fighting this. So at this time, we will open it up to questions. If you have a specific question for the panel, or you just have any one of the panelists, or you have a specific question, we can try to answer it for you.
Lisa?
Yes.
It sounds to me like there's an epidemic out here in this community. Is that
I don't think that there's one person behind me that would disagree that this is at epidemic proportions. The amount of pills that are now on the streets of this community and many communities throughout the United States is something that we have never seen in health, education, public safety, law enforcement, federal, state, local. The amount of pills that are coming through the drug cartels is astronomical. They are easily transported. They're being made in pill mills. They're being brought into this country. They're being brought into this nation. They're being brought into this community. And the ways that children use technology today to access these things is unlike anyone has ever seen before. Because the children of the 60s and the children of the 70s and the children of the 80s who smoked a little pot or snorted a few lines of coke, they had to affirmatively go out and find it. They had to seek it out. They had to find a dealer, pay the money, do all those things. This is a couple clicks. I'm going to tell you what the biggest challenge is for law enforcement, and the biggest way that kids get it is this. This cell phone and this technology brings evil into people's homes. It brings drugs, it brings pornography, it brings human trafficking, it brings opportunities to violate your children every single day. And you want to talk about addictions? We're all addicted to these. Sometimes if I want to take a half a day off to go to an event for my children or a doctor appointment or do something for myself, like maybe get my nails done, this is attached to me at all times. People say, oh, go take a vacation. Okay, I go take a vacation, and this is with me all the time. So what are we modeling? It's just like Dawan said. What are we modeling? How many people go home and they say, I've had such a long day. I need a glass of wine. All of us, we all do it. I'm lucky that I get fierce migraines from alcohol. I don't drink very often because I would be a really good alcoholic, I think, if I didn't get those terrible migraines. Because I come from a long line of people that have alcohol issues. And this is what we have to be aware as parents, that our behaviors or lack of awareness of what's going on in our children's lives is causing this. And we have to be willing to step out and say, it could be me. So yes, we have an epidemic.
And the second question I would have is, the people out there that are using, they have to ask for help, don't they? I mean, most of my, I guess, going through life, I don't hear them asking. They're just using. But they have to ask, don't they?
Yes, they absolutely have to ask. And I think the thing that the message has to be this, is that people who are addicted and who have not hit a bottom oftentimes in any type of recovery, no matter what drug it is or if it's alcohol or anything, they don't think that it's a problem. They don't believe that it's an issue for them. And I've seen videos of children who are on TikTok and other types of social media platforms saying, the feds are trying to keep us from our fent. We can't let them do that. We need to keep it going. They're going to try to take it away from us. Children make bad choices. Young adolescents make bad choices. And so oftentimes they have that vulnerability and that ignorance that it's never going to happen to them. But yes, they do need to ask for help. But parents, educators, faith-based people, nephews, nieces, grandparents, community members, friends, we need to pay attention to see, are these kids involved in this type of behavior? Look in their phones, invade their privacy. Most kids who have phones, they belong to the parents anyway, and you have a right to be in your own phone, especially when you pay for it. So yes, I think they do need to ask for help, and that sometimes is the most difficult thing because kids don't want to admit that they're using, nor that they're addicted.
From a law enforcement perspective, what types of interventions are there now? Obviously, if the method of getting here is pill mills from China rather than the doctors, prescribing, prescribing, whatever, the ability to get it right there on your phone for delivery, what can law enforcement do to intervene differently than they have with prior drug problems?
Well, I think that's a great question, but I think just the question itself lends to the point of view that this is a community issue. It's not just law enforcement. And we can be very proactive. We have been very proactive in the last few years. And I can tell you that Fort, when they respond and when we make busts, we're not talking 10, 12 pills. We're talking 60,000 pills on the latest bust involving firearms, involving gang members. So it's a very complex and intricate criminal system to get poison to our kids. So it's a collaborative effort. I'm so glad that we have so many community partners here that have the resources to provide, not just education, but treatment to people who are suffering. Law enforcement is going to be proactive. We do seek out to find the dealers, and we've been successful in the past of prosecuting individuals who basically sold poison, fentanyl-laced pills, and caused death. And there is an avenue for doing that. But I think it's more than that. We can continue making the arrests, but we'd rather make the saves and save people's lives instead of the arrests.
And I think we'd be remiss if we did not address the fact that these law enforcement officers who are on the street, the sheriff, the police, the DEA, HSI, Fort, they can go out and arrest all day long. And we are very limited in the state courts of what we can do with drug traffickers, people who transport, people who manufacture it, people who sell, people who use, because of the decriminalization of drugs. And that is why my partnership with this lady right here at the U.S. Attorney's Office is essential, as well as our federal partners in the enforcement part of this whole thing. And this is why we are so fortunate here in Fresno. We roundtable these cases with guns and drugs and gangs on a weekly basis. If Kim Sanchez had a dollar for every time I called her, she could probably retire a wealthy woman, because it's a constant communication with our office and her office. And we rely on them because the federal laws are the only laws that are really significant now. And it's very difficult to prosecute these types of cases because of the decriminalization. So a lot of the times there is just not a lot of hammer in the courts. And that's where people who are listening to this need to think about who they're voting for and why they're voting for them. And how these drug laws are not just affecting the drug use, but all of the other things, the acceptance, the children, lack of education, increased poverty, increased unemployment, increased homelessness. These things are all tied together. And for people not to acknowledge that and understand that is just remiss on everyone's part.
Is there not something you can do to attack at the website that they're able to go to, though, the apps that they're able to use to get through these things? I mean, can you not shut those down?
I'm not laughing at you, Corin. I'm laughing so I don't cry. I mean, we try so hard. There is this really painful thing that gets in the way. It's called the United States Constitution, the First Amendment, freedom of speech, freedom of the press, freedom of this, freedom of that. And these companies don't filter, they don't monitor. Yes, if there's somebody that's using a social media app for drug trafficking, we can try to shut it down. But there are so many opportunities for young kids to use the dark web. They have apps that, they have, I don't even know, what do they call it when they have a social media account that's not, there's a trap account or something like that. But they know, they're smart, and they get around it. And the cash apps that make it so convenient for us to pay our personal service providers, or to pay another parent who is getting the cupcakes for the third grade end of the year party. Those are things that people are using every day, but they're being used for illicit activity also, and they're very difficult to monitor.
And out of the 16 known fentanyl-related deaths this year, have any of them been minors?
That's a John Zanoni question.
As far as the deaths this year, I do not have any stats on the actual ages. I know in previous years, our death rates back in 2018, we had 3 drug overdose deaths that were kids between the ages of 10 and 20. And last year, we had 12 drug overdose deaths that were kids between the ages of 10 and 20 years old. So as you can see, the number is trending up. I do not have the specific numbers on this year related to fentanyl. Sorry about that.
Some of these same conversations, I they working for meth as well? Because obviously meth is a much more deadly drug in this community right now, 4 or 5 times more deadly. So is this the same kind of attack mechanism to address that?
I'll go first, but I'll let some of my law enforcement colleagues address. You're absolutely right. Methamphetamines are another substance that are wreaking havoc in our communities. To me, fentanyl remains still the deadliest, just in terms of the gram per gram, what it can do and the amount of damage it can do. But, you know, I think it's naive to think that these are 2 separate populations or 2 separate issues. I mean, you know, whenever analysis is done, you find fentanyl inside of methamphetamine batches and vice versa. And so they're just contaminating each other. And so all of it is a problem. With fentanyl, the overdose from fentanyl can be reversed with naloxone. Methamphetamine requires other health interventions, et cetera. So medically, they're different, but you know, I think it's part and parcel of the overall the substance use disorder epidemic. You know, very flippantly I say, you know, we live in the United Escapes of America, meaning everyone is trying to get away from you know, these root causes of pain, anxiety, frustration, et cetera. And unfortunately, they're taking shortcuts in order to use drugs to escape from whatever they're suffering from. Sometimes people use painkillers to numb their feelings, and other times people use methamphetamines to feel a sense of artificial overconfidence. That's how it starts, but unfortunately, it very rapidly gets out of control, and then the drug controls them instead of vice versa. So either path leads to deadly addiction. But you know, I see them as intertwined in interesting ways, and I'll humbly submit that I don't know exactly you know, the proportion of contamination there is, just because we're not able to get that level of granularity with the lab testing at the healthcare system. Thank you.
And Corin, I think a really important issue to understand the importance of today and focusing on fentanyl is that, you know, you see sometimes it takes a person with an alcohol addiction a really long time to get to that point where alcohol actually causes, you know, so many health problems, that their liver fails, or they have heart conditions, or they have other ailments. And some people drink alcohol to their late 70s or 80s and have been drinking since 13 years. Same thing with methamphetamine. There's a lot of people that use methamphetamine on a daily basis, but they don't overdose. You have to take a lot of methamphetamine to overdose. You have to use a good amount of cocaine to overdose, right? Or sometimes there's people that use those drugs in combination. And oftentimes, and I think Assistant Sheriff Zanoni's statistics will show, that people who overdose tend to be in their 40s and 50s because they've had a long-term, or they have a combination, they have a long-term use, or they have combinations of drugs. But the thing that is so important for everyone to understand about fentanyl is it takes such a small amount. One laced pill, whether people think they're buying a Xanax or a fake Vicodin or a fake Percocet, one laced pill with the wrong amount of fentanyl is a deadly killer. One pill. And I could take a pill and you could take the same pill and it may kill me and it might not kill you. And all the other factors that go into it. Is it combined with other drugs? Is somebody using alcohol? Because fentanyl and alcohol do not like each other. When fentanyl is made and distributed in hospitals for patient care, it is a different grade and a different quality of fentanyl. Street fentanyl is more lethal and more toxic. And, you know, American children think that when they take a pill, it is coming from a manufacturer like they're used to, right? They get it at CVS or they get it at Walgreens, or comes in a prescription, it comes in a bottle. They don't know about all the regulations. They don't know about how everything is monitored by the FDA and everything is carefully measured, and these pharmaceutical companies have all these restrictions. This is coming out of a jungle in a pill press somewhere where nobody cares and there are no restrictions. So every pill might have a different dose. And that is the severity, that's the importance of understanding why this is a crisis, is because one pill is like a deadly bullet for these kids every single time. And every single experience that they have can be different and deadly.
Why are the pill mills using fentanyl? I mean, is it cheaper for them to produce? Why would they put that in there?
Who wants to answer that?
Well, I guess it comes to profit margin. It's easier to transport 10,000 pills of fentanyl across the border than it is to transport 10 pounds of meth. the profit is astronomical, and that's what they're using now. How do we see the amount of fentanyl that is coming to the valley or is coming to the United States? Is because of the price. It's demand and supply. If you look at the price of a pill of fentanyl about 2 years ago, it was about $20 a pill. Right now, you can get those same pills for $5. So there's a lot of those on the streets, and they're making a killing. Drug dealers are taking advantage of an opioid crisis. And this is what we're here for, to make the community aware that this is something dangerous and that we're doing something to combat that.
Isn't one of the problems in society right now, you look at TV, read newspapers, and you see that people that you look up to are being busted or have problems with not only drugs but alcohol? Isn't that one of the biggest issues that is out there right now?
Well, certainly when we see adults modeling behavior that we're trying to get kids not to engage in, that isn't helpful. And we see that, in all kinds of activities that happen. So, part of the message we're trying to send today is the responsibility we have as adults to model the right behavior.
But I'm talking about stars,
Yeah,
Hollywood stars.
absolutely.
People that are in the limelight and young people look up to them.
Yeah, one thing I will say though, and we saw this through the COVID pandemic, is that we're also seeing a lot more high-profile people normalize the conversation about their own mental health. And sometimes when they are busted, what we're seeing them talk about what are the underlying reasons that, cause them to seek out substances to cope with underlying pains that they have. And so I think we have to use those opportunities to also tap into that normalizing of the conversation. None of us feel uncomfortable talking about our mom who got breast cancer, or that one of us is a type 1 diabetic, or that we have, severe asthma, or we carry an EpiPen because we have allergies. But we don't talk about our depression. We don't talk about our anxiety. We don't talk about trauma we experienced. It's just taboo in our society. And when we don't talk about things, that's when we start using substances to cope, because they don't go away just because you don't talk about them. And so we have to use those opportunities when there are high-profile incidents to really tap into those individuals willing to say, I have a problem and I need help, and start normalizing that conversation that it does happen to everyone. And we're none of us are immune. And when we hear that, we have to open up that conversation. Why do you think they did that? What do you think's going on with them? And have those conversations around our dinner tables, and have those conversations in our own communities to talk about why is this happening and what can we change about our community so that we don't have these same issues going on.
Any other questions? Yeah.
Yeah, and yes, we're, in fact, Trina Frazier, right in the back, is my assistant superintendent for behavioral health, our SELPA special ed programs. We're doing a lot of training across the valley right now. We'll continue to do that. Again, I want to just go back, and I don't want to dodge your question, but we are doing training. I want to go back just for a second. You're talking about people asking for help. I want to say this to students, again, if you're on a bus stop and your friend's standing next to the bus stop and a bus is about to come by and they're talking to you and they step back into the bus, what would you do? You'd grab them, right? You'd put your arms around them. It's the same thing here. Our students know, if you want to find out really what's going on, talk to kids. I've been spending, my life talking to kids. And anytime there's a crisis about children, I go to them. And I'm never surprised by what they share with me. But I would say to students, look, I know it's hard. I mean, I graduated from Central High School in 1974, a long time ago. Were there drugs in 1974? Absolutely, there were. But what did we do about it? Were there drugs laced with fentanyl that were going to kill people? Was it okay and acceptable? No. It's never been acceptable. But the hardest thing a child can do is step up and step forward. We know that. We know that's difficult. That's why it's important for parents to encourage your kids to talk, to say something. When that bus is coming by, grab them. The bus right now is fentanyl. So stop it. Stop them. Tell them you're there to help them. You're there to support them, that you love them, that there's so many people up here that will help. This is not about getting in trouble. This is about helping. The things that all of our law enforcement deal with, they will deal with, and God bless them for doing it all. I'm not talking about that. I'm just talking about that child who needs support. And I need kids to step up and put their arms around their friends who they know are using. They know they're doing things. And to say, look, there's another way. If you can't talk to your parents, hey, you can talk here. You can talk to your teacher. You can talk to your principal. You can talk to anyone at school. They will be there to help you. So I know you talked about help earlier, and I agree with you. It's hard to ask for help. It's really difficult, as you know.
In terms of the education that teachers do get, our school's partnership that Jim mentioned, and he mentioned Trina Frazier from his staff, our focus with this partnership is certainly, as Jim stated, to get clinicians in schools and make services available. But we don't go into schools until we've done extensive training of teachers and other school personnel and staff to help them understand, how do you recognize that a kid's struggling. We put a lot on teachers nowadays. We often call education and the emergency department and at times our law enforcement are our backstops, right? We kind of are left dealing with some of society's challenges that we haven't solved collectively. And so teachers have a lot on their plates, things that they're accountable for in the educational system. So we want to help them understand I think sometimes for teachers it's hard when you recognize a problem because that's a disruption to your classroom. And so we try and teach them both how to recognize the problem and also what resources we're bringing to them to assist them so that it's not left to them to manage this new problem that they've identified. And so that training happens in advance of us rolling out the partnership to the school to really prime the school to be able to support kids, to recognize that they might be struggling, to understand that resources are available, and to make sure they understand how to access those resources. We know that if we can help teach kids how to recognize their own emotions, how to manage and regulate their own emotions in a healthy way, that's going to give them the tools they need when they get a little older and some of these temptations come. Risk-taking is part of emotional development and growth and development. It's part of how we all went through adolescence and became adults. And we just have to, as adults, help them manage that and help them grow their own resiliency and skills to be able to manage it on their own.
And I'm glad Dawan said that, because this whole onboarding thing that she was referring to, when we open up our All for Youth programs on every campus, it's not just teachers, it's the entire staff of a school, from the bus driver to the food workers, because that bus driver knows that child every day when they get on that bus. They know what the reaction is, and so thank you for reminding me of that, because that's really an important piece. You can't just train one person, you need to train everyone.
Okay, do we have any other questions? Okay, once again, thank you so much for being here. These flyers that were made, we had them blown up. They say attention parents and guardians, and really that's because the parents are the first line. They are the closest connection to the adolescents, but really this goes to everybody. And one of our superintendents pointed out, said, Lisa, your flyer says fentanyl's on the streets of Fresno. Well, that should have probably said Fresno County, because it's everywhere. It's on the streets of Fresno. It's on the streets of Tulare, Kern, Stanislaus, San Francisco, Los Angeles County, all the counties. We're all suffering. These are what the M30 pills look like. There's just some information on these flyers. There's copies available for you to take in both English and Spanish, and we thank you. And we will, all of us, implore you to do just what Superintendent Yovino said, and that is to help us help these children and help us to end this crisis. Thank you.
Thank you, Lisa.
Thank
Great
you.
job.